everyone. Dr. Mirisse Foroughe, Chief Psychologist at Family Psychology Center, here today to answer the parent question of the day. Today's question comes from Julie, a mom of two girls, 4 and 8 years old. And Julie's asking, how do I know what kind of psych assessment my child needs if the teacher recommends one? So usually if the teacher is recommending a psych assessment, it's likely to be a psychoeducational assessment or psych ed. And this kind of assessment really focuses on how your child learns and what their strengths and weaknesses are and understanding that learning profile. So the kinds of things it includes are cognitive functioning, which is also IQ, and looking at their academic functioning, and then seeing what kind of processing is going on for them. So processing can mean things like, how do I take in visual information? How quickly can I respond to it? It can include things like working memory, keeping information in my mind, and then being able to use it within a few seconds. So those kinds of things can help us explain if there's a discrepancy between how well your child should be learning and what kind of academic achievement they're actually showing. So this can rule in or out a learning disability and help you understand your child's strengths and weaknesses from a learning perspective. So that's the psych ed. The second most common assessment that teachers and parents are looking for is an attention assessment. So looking at whether a child may meet criteria for attention deficit hyperactivity disorder, and just how their attention is compared to many, many other children the same age. So we often do attention assessments within the community, and physicians and psychologists often do these just by looking at questionnaires that the teachers and parents fill out, as well as seeing the child and having an interview with them as well as their parents. Something that we do at Family Psychology Center that other hospitals and centers might do as well is actually testing attention in addition to those questionnaires and interviews. So we want to test your child's attention to see what's actually going on for them. And that's because sometimes when you're filling out questionnaires, you're reporting on what you see in another person, and it may not capture what's actually going on. So there's lots of reasons someone might seem distracted, but when we test attention, we can actually see, are they struggling with attention? What kind of attention? Is it visual? Is it auditory? Is it paying attention to two things at the same time, like the teacher's talking and they're trying to take notes at the same time? Or is it something like sustained attention? So paying attention to something that is not as interesting and paying attention for a long time, being able to hold your concentration. So there's lots of different things that are important to look at with attention, and actually getting some testing done in addition to the questionnaires and interviews can really help provide evidence for there being an attention deficit or not. Those are our two top assessments that people are looking for. And the third one would be a social emotional assessment. So looking at the child's functioning socially, so how well they do with interacting with other people their age, interacting with adults, dealing with social situations, as well as how they're adjusting emotionally. So how they handle their own emotions, how they do with managing their emotions in different situations in the community, at school, at home. So this kind of assessment can also rule in or out things like depression and anxiety and other kinds of mental health issues that might be making it difficult for a child or teen to do their best. So these three types of assessments are our most common ones: the psych ed, the attention assessment, and the social emotional assessment. Of course, there are also others, and some parents really want a 360-degree view, and something we offer at Family Psychology Center is a 360 assessment that sort of answers whatever questions you might have about your child's functioning. So speak to your child's teacher, physician, and therapist or psychologist if they have one, and see if you can find out what kind of information is important to know so it can help you decide what sort of attention might be helpful. Thanks as always for the questions. Please continue to send those in to us, and look forward to seeing you next time.